Hi everyone! We're the Tripler Clinical Group this semester, and today we're excited to present our PBL project, Improving Mood Through Physical Moves. Our project focuses on implementing simple, accessible movement based interventions on our inpatient psychiatric unit to support mood enhancement and overall well being.
For our needs assessment, we conducted verbal interviews with several members on the unit as well as the staff members, which included the registered nurses, the mental health technicians, and the physicians. And during the interview, one suggestion that was made was in regards to physical activity, because majority of the patients on the unit are part of active duty personnel and are accustomed to physical activity and movement. And although there's an area provided for the patients to use, in this type of situation, there is a lack of motivation and encouragement to implement active movement. For our evidence, studies show that 150 minutes of physical activity is recommended each week. This will help decrease chronic diseases by 20 to 30%. And by reducing risks like obesity and metabolic syndrome, it can help decrease healthcare treatments and costs. Physical activity can also increase blood flow, which helps in stimulating neurotransmitters and the production of hormones. For example, serotonin levels helps improve mood, sleep, appetite, and reduce anxiety. Dopamine levels helps improve motivation, focus, and reward pathways. Norepinephrine levels helps improve attention, energy, and stress response. And over time, physical activity can help decrease cortisol levels, which in turn helps prevent chronic stress, irritability, and mood dysregulation. Physical activity is also a healthy coping mechanism or a healthy distraction for individuals, which shifts attention away from negative thoughts and also reduces boredom, preventing anxiety, depression, and intrusive thoughts.
Prior to implementing our project, we gave the patients a survey which had 8 questions ranging from 1 strongly disagree to 5 strongly agree. These questions assess how patients felt about exercise, whether they believe physical activity could improve their mood, reduce stress or anxiety, and help manage their mental health symptoms. We also asked about their motivation, their physical ability to participate, and their willingness to join a short group workout. On the right side, you see the bar graph summarizing the responses. Each question shows varying levels of agreement, but overall we can see that most patients lean toward believing exercise has a positive effect on their mental health and would be open to participating in group activity. These baseline results help us understand where patients started and highlight the need for structured physical activity on the unit.
Based on the needs we identified on the unit, we decided to implement a short, structured workout routine to help patients incorporate simple physical movements into their day. This routine is designed to be safe, low intensity, and easy to follow. We started the routine with light stretches, then progressed to body weight exercises including squats, lunges, squat to lunge transitions, jumping jacks, push ups, and a 1 minute plank. We wrapped up the session with final stretches to cool down.
Here we have the results for our post-exercise survey, which patients completed after participating in the short workout. The survey asked the same 8 questions but focused on how the workout impacted their mood, stress levels, motivation, physical comfort, and overall understanding of how physical activity supports mental health. On the right side, the bar graph shows that most responses shifted toward the higher end of the scale, particularly areas in improved mood, reduced stress or anxiety, and feeling that the exercise were appropriate for their abilities. We also saw strong agreement in questions about wanting physical activity sessions to continue on the unit, which highlights patients' interests and engagement.
After implementing our PT with the patients, we asked the staff for their input. They told us that our exercises were good choices. Since they are all active duty members, they're used to doing a lot of push-ups, so they mentioned that that was a good addition to our workout routine. They also mentioned that it was very engaging. We decided to let each participant choose their own song to play throughout the workout, and staff mentioned how that was a nice addition for them. However, as aforementioned, all of them are active duty members and they're used to vigorous activity, so the staff brought up that our routine may have been too easy for some of them.
In summary, our project showed that adding brief physical activity sessions meaningfully improved patients' mood, motivation, and anxiety. Although many patients initially felt unsure and motivated by exercise, post-survey results showed clear benefits and a better understanding of how movement supports mental health. Patients found the sessions engaging and they said they would like to continue them. Overall, our findings show that simple structured movement can be an effective, accessible way to enhance wellness and support psychiatric care. Thank you for listening.